Hey, what's going on, guys? It's Ethan with Mind Body Physio. I wanted to come on real quick and discuss two different ways to glide your median nerve. This is really valuable if you're having symptoms of like carpal tunnel or cervical radiculopathy or anything where we're getting nerve pulling type pain or paresthesias, tingling into the wrist and hand, specifically into what's called the thenar eminence, but the thumb and the first two fingers are primarily the parts of your hand that are supplied by the median nerve. And the nerve can get restricted at a couple different routes. It can be down here at the carpal tunnel. There's a couple points along the middle of the arm it can get restricted, or it could be getting restricted up near the cervical spine or along the collarbone underneath the first rib if it's like a thoracic outlet type presentation. But regardless of where it's getting restricted, we really want to keep that nerve mobile and moving. So these nerve glides do a really good job at wiggling the nerve back and forth within your system and kind of freeing it up from any adhesions. I always try to give this scenario of like if you're pulling a post hole up out of the ground, you want to wiggle it back and forth as you pull up. You don't just want to pull statically. Nerves don't really stretch, but they can wiggle out of adhered locations. So if we've got a nerve that is sort of stuck to the tissue around it, wiggling it is the best way to free it up from that restriction. And that's what these nerve gliding or nerve flossing techniques are trying to accomplish. So the first one we're going to go over is a variation of the median nerve test that we do to look for tension intolerance. And that is where we're going to be, you stand tall always, the shoulders are kind of down and back. We're going to position the hand as if you were holding a tray out to your side. It's really important while we do these that we maintain this wrist extension of as much wrist extension as you have, and that your fingers and thumb are flattened out and they're straight out. As we do this, we are going to move the hand and the head together. We're maintaining that wrist extension and we're pushing our hand out towards the wall beside us as we move the head with the hand and then bringing it back like this. Now what this is doing is I'm lengthening the nerve from the point of the arm, but I'm slackening the nerve up at the neck. And so this would be considered a nerve floss, because as I'm lengthening it from one end, I'm shortening it from the other, and we truly are trying to glide that nerve back and forth and kind of wiggle it through its nerve tract. Now I can tell you as I'm doing this, I'm getting some kind of tingling in my fingers and things like that, which is all considered normal. That should go away right after you do the glide, but you really do want to do these nerve glides gently. Nerves are not like muscles. Again, they don't, when you put them on stretch and hold them for a long period of time, they don't just let go and relax because they don't have that elasticity that the muscle tissue does. So we don't want to put a lot of sustained pressure on a nerve. We just want to kind of bump our symptoms and then come right back out of it. You should feel as you're getting towards that stretch position, a pulling, a tightness, some kind of abnormal, we call it paresthesia because everybody perceives it a little differently, but it's just an abnormal sensation of the tissue, of tautness or tightness within that tissue. So you should be feeling that as you go out into these stretches, but we don't want to just put it out there and hold it for 20 seconds like we would a muscle stretch. The nerves aren't going to respond well to that, and we don't want to go too aggressively into our symptoms. You want to just kind of find them and come right back from it. The next version is we're still going to have that wrist extended at almost to 90 degrees if we can, and we're going to put our hand down towards the floor. On this one, you want to try to drop the shoulder down a little bit. You may already feel that pulling in your hand, but then you're just going to gently move the arm from this position straight out to the side with the shoulder staying depressed. And as you do that again, we're going to bring the head towards it and then back down. If for some reason neck side bending does not agree well with you, you can also rotate. So we can move the hand out from the body as we gently rotate it towards the same side at the head, and that works fine well. Fine also. So two different options there. We've got the tray hold and stretch, or we've got the depression of the shoulder extending down towards the floor and stretching out that way. I really like both of those. They're both pretty specific to the median nerve. You are going to get some other nerves in there as well for mobilization, which is great. But the way I like to do these is 20 repetitions, 3 to 4 times a day. But again, very, very gently. I like high frequency, low intensity for nerve mobilizations. That seems to work really well. So try these out. Let us know what you think. Again, please, if you're doing these, hopefully you've been screened by a provider and you're not kind of self-diagnosing nerve restrictions, because they can be pretty tricky to correctly diagnose. And I would say that there are certain situations where you would not want to be doing these types of exercises with similar symptoms. So hopefully if you've been diagnosed, this gives you a good exercise program to start on. Pick either one of those, whichever one feels more valuable to you or reproduces your symptoms or reproduces that stretch in your tissue more specifically. And then we're going to go through those 3 to 4 times a day, 20 repetitions each. And you should be seeing throughout the course of the first week that you're either able to get more mobilization or your symptoms are lessening as you're going through that. If you're not finding that to be the case, again, you need to reach out to your provider and let them know that this is going on, let them know what your symptoms are, and they can redirect you towards a different course of treatment. But hope this was helpful, and we'll be doing more videos like this, so stay tuned for the next one. Thanks, guys.